Welcome, everybody. We're going to get started. So before we get started, I want to wish the man who is the inspiration and perspiration for the self-determination law of Harvard Fields, Harvard Lapin. Why did I say? I know Harvey Fields.
I went to Michigan. I didn't go to Harvard.
Okay, University of Michigan, Harvey Lapin. A happy 85th birthday. Yay, Harvey. And Harvey and Connie are going to be here because I want to present to you some interesting, an interesting letter that was sent that they forwarded to me. So what I can't seem to share it today. I will not be sharing it. Sorry, all the people in the world. Connie sent me a copy of a letter that was written not recently, but I want people to guess in the chat when this letter was written. And I'm going to read you some lines from it because a lot of it pertains to the subject matter today of what the state budget has in it and in its relationship to the self-determination program. So this is a letter, by the way, to DDS. So DDS, the deputy director, who was Eileen Ritchie at the time, who then became the head of the Association of Regional Centers, saying that so it expressed concerns first about the position of the case manager, which is what they called it back then, or service coordinators, which is what they call it now. The case manager has an inherent conflict. That position needs to get back to the original intent of the Lanterman legislation, wherein the case manager was not only the person who helped the consumer and family plan and monitor an appropriate program, but was also charged with being an advocate for the consumer. As the gatekeeper, the advocacy function has been totally negated. So that's obviously an interesting concept. Number two, we do recognize that there are too few resources, that direct care staff in most programs are grossly underpaid. So we need support and services level where we need more funding for service providers. Number three, the regional centers as gatekeepers have lost sight of what the system is all about, the consumers and their families. The consumer gets lost in the regional centers' efforts to stay within budgets and within narrow guidelines and definitions of what is permissible and what is appropriate for the people for whom the system was designed. Number four, throughout the regional center system, there is fear and paranoia on the part of the consumer and his family because so much of his life is dependent on programs funded by the regional center. The gatekeeper function has corrupted a relationship that was intended to be cooperative into a them versus us relationship. Number five, we recognize the need to conserve resources. We also know that much of the budget goes to paper compliance rather than people outcomes. Without true dedication to consumer outcomes, which enhance and normalize lives, resources are not being used properly. And finally, number six, regional centers must recognize an opportunity to return to their original mandate by fostering self-determination for consumers and families. Remember, this is before the self-determination law passed in 2013. This year, there are 3 pilot projects that, if implemented, would restore a great deal of confidence in the developmental disability system. There is great potential here, and we really look forward to the promise of the Lanterman Act fulfilled. So I'm wondering if anybody wants to guess when this letter was written.
By me and
by Connie and by Ann Snowbrook of the Autism Society of Los Angeles. And you can put it in the chat, 1999. That's a very good guess. Cindy Cox knows what was happening in 1999. Good guess. Cindy wins because it was actually December 1st, 1998. So it was just on the cusp. The self-determination pilot project had just been passed in 1998, and it hadn't yet been implemented. It was originally implemented in 3 regional centers. And the concerns of this letter dealing with all the things we talk about, which is that we need advocacy at the regional center and not gatekeepers, that we need people to be able to have good outcomes as opposed to compliance, that there are too few resources for service providers, and particularly the direct care staff, and that there is fear, a sense of fear among families. And so it was in 1998, and I don't know, Connie, if you want to say, like, what was different about back then and what is the same that we're facing in this budget?
So I want to give a speck of a background, and I want Harvey to interrupt if he needs to, is for those of you that don't know me, my son, Sean, who experiences severe autism and is duly diagnosed, is 54. So our family grew up with the hope and dreams of the Lanterman Act. And part of the Lanterman Act was, as you can see, as mentioned in the letter, was actually the concept of self-determination. So 1969, the Lanterman Act was passed, 71, it took effect, and Sean, my son Sean, was diagnosed in 1970. And so I was around when there was only 2 regional centers before there was 21. And we had the hopes and dreams of the, we called them the case manager, to be our advocate. In fact, over time, we tried to take case management out of the regional centers. And oh boy, did that create a lot of pushback. So basically what I'm saying is that when I found this, I was going through old letters, I'm thinking this could be today. This can be today. There's paper compliance, and we're not advocating for what the principles are, the deep principles of the Lanterman Act, which is choice and control and freedom. And we recognized that self-determination was the answer. We recognized it then when the pilot programs were just starting. And it's very sad to me, and this is what happens when you're a pioneer. Sean's 54, so I keep saying he's older than me, but we've been around a long time. I have written those letters and rewritten those letters, and I'm sorry to say that even today, we keep hearing, you know, someday this is going to work. Self-determination is going to really take off. And I love this quote that says, someday is not a day of the week. I want to know when this is really going to happen. And Harvey, you might want to say something.
Yeah. Why did self-determination happen? Because outcomes were terrible. And that's the purpose of it. I walk around always. I've worn 3 or 4 of these books out. Did you take my Constitution?
It doesn't matter, Harvey.
The Constitution of the United States. This is all I do. Here, oh, here it is in my hand. It's a civil rights movement. It always has been. And what I say to you today, why you bring this up, we're happy. We happen to be very lucky to have a very good case. I call them case managers still. That's what happens when you're old. But the issue is you won't have just about 1,300 people in 3 years in self-determination, because your first stop is your case manager. That's where you start the ball rolling. And the bottom line is that part outcome. That's why I'm just going to say successful places, you can be at the absolutely at the reach, but carve it out. It's conflicted. You want people who want to do this, not people that are ordered to do it. And I believe that will make a big difference. Timelines, definitely. A person with authority at the original meeting to create a budget. I do my study throughout the state, the country, and the places that are successful have timelines, and you're in and receiving services in Michigan in 1 month. I asked Wayne County and Oakland County that are all those 2, they're mental health centers, but they're regional centers. Everybody in there is in self-determination. You want job satisfaction, I'm telling you, I say this to case managers, you will get it, I promise you, when a person's life is better.
And people go into this field as social workers to help people, and it's become a paralyzed bureaucracy.
And it's not all over. What bothers me a lot is the dismal results you see at certain regional centers, and it's consistent. You know, when someone says this is how many people in to me, I can name the regional center.
Mhm.
Yeah, and I want to thank you, Judy, for letting us share this letter with everybody, because if you're as old as we are and you've experienced this over and over again, we've got to make a difference. And I think DVU is making a difference, and I think self-determination will make a difference. We just got to have it happen.
We will never give up, ever.
I am going to put this letter in the chat if I can just make sure that I'm putting the right things. Yes. Okay, I'm going to start with this one. And then I'm going to put the second page. These are just photos of it. And I'll put in the chat so that people have it and are reminded of how long we've been struggling here. Okay.
And the
thank
answer
you.
was self-determination.
Yeah.
That was the answer.
Yeah, thank you, Connie and Harvey. Really appreciate that. And Connie and Harvey are going to stay by to answer any questions that people have after, because Connie's been involved in state budget advocacy since before you were born, people.
Yes, yes, yes.
You know, I heard a guy.
Well, you're supposed to learn from history, and
Yeah, yeah.
right? Or
Yeah.
it just repeats itself, right?
All right, so let's get started. So the presentation today, I should start with, was supposed to be conducted by mostly by people not from DVU. And it was supposed to be Vivian Hahn, who's actually on DVU's board, but mostly she's the senior staff attorney at Disability Rights California in their intellectual and developmental disabilities practice. And she unfortunately had another meeting at this time. We were also hoping to have Mark Melanson from the California Community Living Network, which are folks, amazing service providers, community-based service providers. He is visiting his family in the East Coast. So you're stuck with Nina and me. And we will do our best. There are probably people who are here in this call who may know more about some of these things than we do. Please feel free to chime in. We are not an expert on every single part of the budget. I also, before I get started, I'm going to stop sharing. I'm pretty sure she's still here. I'm just going to make sure. Oh, she's gone. She was here. The DDS hired their permanent SDP ombudsperson, and she was here. I saw her come in, but I guess she had to pop out. Maybe she'll come back. DDS has hired Susie Reckwarth to be the permanent SDP ombudsperson. Some of you who are from the San Diego area may know her, as she is the participant choice specialist at San Diego Regional Center. But she is also, she's also appeared on SDP Connect, and she's really a champion of the self-determination program. And we have high hopes for her at DVU as the SDP ombudsperson. So please feel free, everyone. She doesn't start till like mid-July. She needs some time to transition out of her current role. But she has promised that her first public appearance will be on SDP Connect at the end of July. So we will, I think it's July 27th or something like that. So we will be advertising it way in advance so that all of you are part of it, okay? But she's pretty terrific, and we're very, very pleased. All right, so now I'm gonna go back to sharing my screen, and Nina Spiegelman, our Director of Policy, and I will try to do this right. All right, so what we're looking at, and we've done this before, where we look at the state budget on, and its impact on the self-determination program. Some of what we're going to be talking to you about today is sort of ancillary, aside to the self-determination program, but it still has an impact in certain ways, okay? All right, so first of all, let me explain what the state budget is. So your regional center services are funded by both state monies and federal monies. For every dollar that the state spends on regional center services, it's matched by anywhere between 50 cents and $1 from the state. It really depends on who you are and what kind of services and all that kind of stuff. But it's matched at a minimum 50 cents to the dollar. So obviously the state budget is just one piece of it. Our total state budget, by the way, is over $12 billion. This is not a small little program. All right, you should know that the state of California does not run on a calendar year. So when we say the 2023 budget, it actually started on July 1st, 2022. So it's a fiscal year. The process is that the governor presents the budget to the state sometime in January, usually around the 15th of January. And then the legislature has a set of hearings. They present their own take on the budget, and they may add things, they may take things away. And they've already had all their hearings on the state budget, and they had a hearing in February, in March, in May. And remember, there are two parts of the legislature. There's the Assembly and there's the Senate. And each of those different sides had their own hearings. Then on May 10th, the governor every year presents their revised budget. You may have heard it called the May Revise before. And what that is the governor sets his budget in January based on what he thinks is going to be the tax revenue for the year. How much money comes in on taxes is a guess in January. But by May, the state has a better sense of how much money is going to come in. And so they adjust the budget at that time. And that's why it's called May revised budgets. And sometimes the budget goes up and sometimes the budget goes down. This year, the budget went up profoundly by $68 billion. That's the whole state budget. Now, what they're going to end up doing with that $68 billion is still unknown. The governor has his set of ideas. He wants there to be a gas tax refund and some other things. He wants there to be some ridiculous idea called care courts. So there's a lot of these ideas the governor has, and then the legislature has their own ideas. They negotiate together until about mid-June. And when I say they negotiate, it's really the head of the Senate, the heads of the Assembly, and the governor's office. It's really these sort of 5 entities that sit and negotiate down to the details of every single part of the budget. And the governor must sign the budget by July 1st. Okay, so just wanted to let you know the process. So the first thing that's in the budget that we're starting with the great news. The great news is that the governor is proposing in his revised budget that we will eliminate the legal requirement that the cost of the FMS be paid out of the individual budget. So for those of you who are using the sole employer, you're likely paying about $1,800 per year to the FMS. That $1,800 is going to go right back into your budget to be used for other things, which is pretty great. The cost of the FMS is also added. Sorry, I already said it. The $7.2 million is what they're estimating this is going to cost in total for the number of people who are in the self-determination program. We need to say this is a very, very good idea. We really, really need to push this as much as we possibly can. We are urging you to send a letter of thank you or an email of thank you to DDS for putting this in the budget. And you can contact your own legislators. At some point when Nina's speaking, I'll put into the chat a way that that you can find out who your assembly member and your senator is. And we will put that in the chat, and you can all you do is go to their website and you'll be able to send a quick email to say, thank you, we support the DDS proposal on FMS fees. Jordan, it looks like you have a question already. Go ahead, Jordan.
Just real quick, you said that you would get to keep that money if a consumer is, I have two quick questions. Consumer is coming from traditional services into SDP, the FMS isn't part of their budget already. They don't have that in. It's only for you don't have that built in. So your budget meeting would then your IF, whoever's helping you out, or regional center would then add in the cost of that FMS, that financial management service, excuse me, at whatever rate you just mentioned, and with the number 1,000 something, they would come up with that. But since it's going to be paid through this other entity or another way to be paid, they just wouldn't add it to your budget. So it's not like you're going to get that extra money. I'm like saying, well, I'm saving $1,000, so they're just going to give it to me. They just won't add it, and they'll just take it out. And if you already have a budget, they're going to pull that out on your next year's.
No, not true. They never added extra money for your FMS. They never increased your budget to include the FMS costs. You had both the FMS and the independent facilitator had to be part of your original budget amount. So you would take your budget amount. It is not increased. It's very specific in the law. Your budget is not increased to pay for the FMS. But then when you put in your spending plan, you have to have a line item for your FMS. So from now on, that line item, it no longer needs to be there. And all that extra funding that you would have had to spend for the FMS, you could spend on other things.
You would think, unless they want to pull that out and say, look, that was for FMS only. And unless they're going to find a way to move that to another category, what category does that go under? And if regional center says, hey, you know what, that was for FMS, you're not having FMS, you're not doing, I don't know, you're not doing art class anymore, so we're pulling that part out. They just decide to take it out completely and not give it to you. And that's going to let you keep extra money, at least from what I understand.
Yeah, so this is a great benefit, by the way. Sorry, choking on a drink. I do not have COVID. I'm fine. Somebody was asking in the chat if they're increasing the FMS rate. They are not increasing the FMS rate. The FMS rate will stay the same. You should know that the rates are set and they're actually in our federal contract to fund the self-determination program. And so if they're going to change the rates, they would have to get federal approval for it. You should know that if you have a budget that you think you need specific extra help from an FMS, you are able to ask for an increase in the rate. It's an individualized basis. You should also know that coming in the future, the FMSs are going to be getting additional funding from other sources, particularly to help people transition into the self-determination program for the first time. But to do the sort of standard bill paying stuff that they do every month, those rates are going to stay the same. And I believe that many of them are okay with that. What their concern is the amount of time it takes for FMSs to actually transition people into the program for the first time. Those are the pieces that are really quite time consuming for them. All right, moving along to fair hearing reform. So many of you know that DVU and along with other organizations such as Disability Rights California, the State Council, the California Community, that's a different bill. Who else? The Integrated Community Collaborative, and many other groups.
Public Council.
The State Council, right? The
Public Council too.
Oh yeah, sorry. Public Council, very important, have done a lot of work. Have sponsored a bill called SB 1092, which is about fair hearing reform. Well, in the revised budget, DDS has taken some of what we've asked for and put it in the revised budget. It's different though from what we have asked for. In some ways, like we argue that the fair hearings should move from the Office of Administrative Hearings, where the culture is very problematic, we believe, to the Department of Social Services that handles fair hearings for almost every other public service program. such as CalFresh and IHSS hearings and Medi-Cal hearings. And we are just like those programs, and we feel it would be best for us to move to the Department of Social Services. We are not getting that right now for a range of reasons. But what they are doing is trying to change the culture of the Office of Administrative Hearings. You should know that OAH sits under something called the Department of General Services, or DGS. It's a department just like DDS is a department. And they have asked for funding to create 5 new positions at DGS to monitor the judges, to train the judges, the administrative law judges, to ensure that things are moving in the direction we want it to. We have concerns about that, but we will be monitoring the situation. They also put new rules in place that, number one, no lawyers for the regional center if the person served doesn't have one. We don't know if that's going to survive, but that is something that we are very pleased that the governor put in. They talk a bit about something called engaged neutrality for the judges. So the judge has to ensure that the case that the person who's going to fair hearing is making is the best case they can make. They can't be biased in favor of the person over the regional center. But we are not lawyers. We don't know exactly understand all the little ins and outs of fair hearings. And so the judge is supposed to be asking questions and helping us rephrase things to make the best case for ourselves. That is what they're supposed to be doing. Let us see if that happens. Regional centers right now have the option of declining to go into mediation. They now are required to go into mediation. There's supposed to be better training of the hearing officers or the judges. And we believe that one of the biggest problems has been that DDS has been in charge of the trainings, and the trainings haven't taken place in many years. So we have judges saying, what is the self-determination program? I never heard of it. Or even worse, in my opinion, is they turn to the regional center and say, explain to me the self-determination program. So they're getting the regional center side of what it is and not asking the consumer or what we call the claimant, the person at the fair hearing, what is it that you want me to know about the self-determination program? Finally, there's a lot of really good language around preferred language. So that means that right now, people who speak languages other than English have to make all these formal requests to have all the materials related to fair hearings in the language of their choice. And now it is written throughout the law that deals with fair hearings that all communication needs to be in somebody's preferred language, as opposed to, even if a person, let's say, speaks English and Spanish, they may prefer to have all the materials in Spanish, and the regional center would be, and the judge would be required to do that. And finally, they create a stakeholder group to bounce ideas off of. That is different than what we have in SB 1092, which is an actual advisory committee that meets quarterly and provides guidance to the Office of Administrative Hearings. It's very similar, excuse me, to what they do in the Office of Administrative Hearings holds hearings in the special education world, and they have an advisory committee that meets quarterly. And so we wanted to mirror that. So we hope that that's what will happen. All right, moving on. I gave myself all of these in a row and I'm coughing. Hold on. Okay. They're also creating in their budget something called the Division of Community Assistance and Resolutions, which, by the way, the fair hearings stuff will be part of this division. But I wanted to let you know about a lot of other things that will be under this division, and that they are adding, DDS is adding 20 new positions. Something you should know is that throughout the budget, DDS is adding gobs of new positions. There are, I actually, we should really go and look at the total number of positions being added at DDS in this year's budget. It's a whole lot. So you should know that regional centers are also getting a whole lot of new positions. And service providers are getting some rate increases. And so I'm just warning everybody, my theme for 2020, the 2022-2023 fiscal year is no more excuses. The regional centers are getting tons of money. DDS is getting tons of money. We're not getting so much in services, by the way, but everybody's getting tons of money. I don't want to hear any excuses that people are underfunded anymore. We deserve really excellent service coordination. We deserve excellent fair hearing officers. We deserve excellent oversight by DDS. All right, they're also adding positions that are called ombudspersons for all the other programs. So that is different than the ombudsperson for the self-determination program, which was created in law last year. And is accountable directly to Nancy Bargeman at the top, even though they are supposed to be completely autonomous. These ombudspersons are not autonomous. These ombudspersons are not independent, and they're more mid-level staff. The other thing you should know is that the ombudsperson in the self-determination program can actually help advocate for people, can actually help try to resolve disputes and concerns. These ombudspersons in all the other programs, there will be early start, there will be, I don't know, what all the different programs they have. These ombudspersons are not going to advocate for you. They are not going to try to resolve your problems. All they're going to do is send you information. So please don't think that these ombudspersons are going to be the answer to all of your problems. They are going to be people that you can call and say, my regional center says X, is this true or not? And they can send you materials to answer whether these things are true or not. The other thing that they'll be able to do is to identify these trends and send these trends to other divisions of DDS. So let's say there's problems that are being heard about people getting eligibility for regional center services, and that there's consistent problems. What could happen is you go to the ombudsperson, they explain to you what the eligibility rules are. But if there's consistent problems that ombudsperson is seeing, they may then go to the Division of Community Services to say to them, you should really look at this because, this particular regional center is having these issues, but from a lot of people who talk to me. They will also manage what's called a whistleblower complaint. Whistleblowers are people who file formal complaints against service providers. Sometimes they actually work at the service provider. Whistleblower complaints are against regional centers, so they might be consumers, family members, or even employees of the regional center. There are people file whistleblower complaints all the time, and DDS doesn't do enough to look at it. So hopefully this will manage it a bit better. They also have these offices called Quality Assurance and Risk Management. These will be separated and beefed up with lots more staff, okay? Risk management, by the way, is actually a very important division to add staff to. Those are for things like special incident reports when somebody gets hurt or restrained or secluded at a service provider. Those complaints need to be followed up by DDS, and it's just not happening. If there's anything DDS should be doing, it should be doing that. So I'm very supportive of that. Okay, moving on. Nina gets to take over.
Okay, and you'll advance the slides, right, Judy?
Yes.
Very good. Okay, so I'm very happy that I get this one because this is what we've been waiting for a very long time. So this is called Coordinated Family Support Services. I hope, a bit of a misnomer. This is what we like to, and we've been calling amongst ourselves sort of SLS in the home. So this is the service intended to be similar to supported living services for adults who live with their family. And, and I think that means it could be with even if it's not with their parents, if they live with their grandparents or aunt and uncle. So they live in a family home with some part of their family. And this is starting out, again, I think you've heard us ask each other, is this a pilot? This concept came on the scene like in 2021, and we did not see any details, and DDS right now is starting to flesh this out, and it's starting life out as a pilot project using these one-time funds, which actually happened, I think, last year. The likely rollout we hear is early 2023, like January 2023. And the services, and we've been trying to get as much detail as we can. DDS is reaching out and meeting with stakeholder groups and community organizations, and they're still going to do that, I think, through June. But what we hear in general is that the intent is to make this like supported living services. Their materials to date are a little heavy on coordination, but they are looking at, sort of incorporating a lot of the concepts from the SLS regs. And that's reflected in these bullet points, which are developing skills in the home and assisting with living activities. And that should be both providing direct services, providing the support you need in addition to coordination. So I think that we believe that is the intent, but we have to all be vigilant in making sure that it actually happens. And then getting and coordinating delivery of services and doing things, helping you do things in the community. Next one.
There you go.
All right. And so right now, when we confirmed this today, that DDS is seeking input. And so I think it's, this is such a service that could potentially be great. It's both great in and of could be great in and of itself. It's a very much needed service for people in the home, but it's also could be helpful in obviously building your budget in self-determination if that's something you qualify for. And so right now, Vicki Smith at DDS is, looking for input, and here's the information on just her email address. So anything else you want to add, Judy, to this?
No, Nina and I literally met with Vicki right before this call and got some good clarification. And did you talk, Nina, about how it's related to the self-determination program?
Well, I said that, it could potentially be very good in building your budget if you qualify. If you argue, this is a service I qualify
Right.
for in traditional services.
But unlikely, I'm not sure what they're going to do before it goes statewide. So this pilot program is going to begin on January 1st. What we have to advocate for, this is the action alert here piece, is that, and thank you, by the way, to our wonderful new program assistant, Kira, who put together these slides way better than I could. That one of the things, if you're emailing Vicki, is to say, we want to make sure this is available, even in the pilot project, to people in the self-determination program. You shouldn't have to leave self-determination to be able to access this service. So there is going to be some requirements or some sort of.
Right. The details on eligibility or
Yes.
how they're doing this, it is going to be very likely available at all 21 regional centers. There's also, one of the things, feel free to add in any comments you're making to Vicki, that, part of all this budget info involves also proposed statutory changes to implement the budget called trailer bill language. There is some trailer bill language. It's very brief. It has almost no detail that just gives DDS the authority to issue directives and regulations for this. But there's no detail. And that may be a place to say, hey, you should require, stakeholder input and, making sure that it's there's a focus on reducing disparities, or other things that there should be more clarity and specificity on. So whether or not we'll see directives, they're really working on kind of getting it's very conceptual right now, but job one is making sure that it really does look like SLS for the home, as opposed to just another navigation or coordination service. And also, so if after the end of that year, after December 2023, then hopefully it will get continued, by the governor as a permanent service and become part of the budget as a permanent service after that.
Great. I am just gonna, before we go on to this next thing, I'm gonna stop sharing because Susie just got bumped out. Susie Reckworth just got bumped out and she's back. So I'm gonna find her and I'm gonna make her
Judy.
Okay, thank you, darling. So Susie, we want to introduce you. Susie's like, I wasn't expecting to be on, so I'm not sure I'm going to turn on my camera. And I'm like, don't worry, you don't have to be dressy for us. Although I did wash my hair for everybody today. You should be proud of that, but it is sopping wet. But Susie, I'd love for you to just give a shout out and say hi to everybody.
Hey, everybody. Hopefully you guys can hear me okay.
We sure can.
All right. Yeah, I'm not in the best camera condition. I just got done working out. So I'll save you guys from that. But it's nice to meet all of you that I haven't met before. I'm Susie Reckworth. I currently work with San Diego Regional Center. I've been involved with self-determination for a few years now. And I'm super excited to move into the new role of ombudsperson. And for those of you that I have worked with, I think this is going to be exciting. I'm ready to get in there with you all.
That's so great. So tell us, when are you starting, Susie?
Start date is July 11th.
July 11th. Okay.
Yeah.
And she's already promised to be on STP Connect, where she'll answer lots of your questions or sit and listen to you. We'll figure out what Susie wants to do as, after she begins there.
Yep. I'm definitely looking forward to working with everybody here. You guys always have such insightful feedback. I listen in often just so I can hear directly what people are experiencing. So I really appreciate this group and I look forward to working together.
Well, you're getting lots of love in the chat. People are going to miss you in San Diego and people are very excited to have you on board. We've been waiting for a permanent ombudsperson for almost a year now. So super excited, excited.
Thank you for the opportunity to introduce myself, Judy. I appreciate it.
Thank you. All right, I'm going back to sharing my screen. We will continue on. Okay. This is you again. Go ahead, Nina.
Okay, so this, and I'm sure people like Will who are much more expert in the budget can correct me if I'm wrong, but I mean, we're very pleased to see this like sort of catching up other agencies like DSS, other pieces of the Health and Human Services pie had started doing these things. And finally in the developmental disabilities world, we're starting to add this and that's a good thing. So, there's looks like up to two $500 training stipends will be available for DSPs, which I think is, essential. I think that had been available for IHSS and now, now it's in our world. And
it is definitely available to people, staff. So remember, this is direct staff who are working directly with the self-determination participant. This is available to everyone in the self-determination program as well. So Tim, if you want to send your 8 staff to receive these trainings, I'm not exactly sure what the trainings are about, but I'm 100% sending my staff because hopefully they'll learn something. They will then get up to 2 $500 stipends plus the $150 for taxes and administration. So that's very exciting that our staff is also eligible for this.
Then there's also this next item. Maybe Judy, you know more. I don't know any details beyond this, but this is an internship program for workers who provide direct services. And there's a 3-month training and internship program. and it's intended to create an entry point into DSP career paths. Maybe others have more details on this, but I don't know what the vision is here, but hopefully.
Please raise your hand, because honestly, it doesn't make any sense to me. Because internships are generally for positions that really, really require, higher level stuff. Like we have interns at DVU so that people can go out and get jobs in policy or go into graduate school. So I'm not really Will Sanford, anybody on here, does anybody know what this is about? And why would someone be an intern when they could just get a job as a DSP? Oh, Will. See, I knew Will is always reliable.
Will knows all this stuff.
Will is always reliable. Go ahead, Will.
The problem with this is it's one that the governor dropped into the budget in May. So there was no precursor to this in January. So we only sort of know what they've said. I mean, the training stipends are also available for regional center social workers or case managers to improve their skills also. So it's not DSPs purely,
Right.
as noted, which is helpful because again, it could be another way to help retain, good service coordinators by giving them professional development. My concern on the internship program is similar, Judy, in that this is a program that doesn't exist for DDS right now, which means, as we've noticed, anything else that's new in development, it takes them 9 months to a year. So is this really going to help with the more immediate problem that we face today of getting enough direct service professionals to deliver service right away? So, I mean, there's a lot of unknown questions in that space as to what this looks like and how this is going to get implemented, even on the training stipends. And we literally know what's in the budget document, which is not enough to write home about. I mean, it really is one where we'll see. I like the idea of getting people. I want more trained people to be able to do it. That's cool. But, when DDS doesn't have a fully formed plan and they throw $185 million at it, I'm not sure what result we're going to get. I'm hoping we get a positive one. I'm not necessarily seeing it.
I honestly do not understand this at all. Thank you, Will. Appreciate that. Next slide, Nina.
Yeah. Here's another one. Perhaps Will can enlighten, or anyone else. Again, not entirely sure about this or even what to think of it, but there, at least in the May revise, and maybe this got some amendment to it that I did not see, but this pilot for remote support. So $5 million to pilot a program aimed at developing remote supports to increase consumer independence. And here's the part that makes me nervous, but perhaps I'm just paranoid. It says, and when chosen and safe, reduce in-person and around-the-clock services. That part makes me nervous. Maybe, I don't know. Maybe this is a good thing. I don't know, but it was in the May revise, and so we're pointing it out.
I mean, real quick on that one is it's one that's actually CSLN and someone else we're having a bill related to this, and we're pushing this as a way to really look at use for remote supports, which is not used a lot in California. I was at a conference actually where a woman who formerly had 24/7 supports was down to about 8 hours of in-person support, basically based on a smart home. Was able to really live a much more independent life in that space. It's not going to work for everybody, but for some folks, it may really increase the independence. So I think the pilot is aimed in the ILS, SLS space to try it out. That's when
it's actually a great idea. And I don't know if Diana Galdelara is on this call today, but she uses this concept now, and she's not even part of a pilot, and she likes hours during the day to have nobody in her apartment so that she has some privacy. And she's able to have emergency ways of contacting people in case she needs help. I see Lori. Go ahead, Lori.
Yeah, hi. I was actually pre-COVID.
Wait, introduce yourself real quick. I should have had Will do that.
Lori Shepherd, Avenue Supported Living Services, and also working as an IF with some people. I was actually advocating for this concept even before COVID, but with COVID, I was able to get a foot in the door and actually talk to some people in Sacramento and kind of push the idea. It's being done in states that are very rural, that have always had trouble with staffing. It makes a lot of sense, both for, like Will said, people who want some of that independence, and people who have trouble finding staffing, where the ILS worker just doesn't show up for weeks and we don't even know if they got their meds. It's a really, really awesome concept. I'm so excited that it's going to be happening. So that's just my 2 cents.
That's great. That is exactly, that's great. I'm glad it's
If you guys support it, then we support it.
Yeah,
I totally support it.
great. This is good. Great information. Oh, I'm cross-talking again. Forgive me, Lorna. Okay. And finally, just in our count of taking note of new positions at DDS, there's a funding for 7 of them to support efforts to address challenges in recruiting and retaining DSPs and regional center service coordinators. And, it is, it's a giant issue. Workforce under the rubric of, promoting workforce stability. It is super important, and it's important to the feds. So, these were some of the bigger items. And let's see here. And then Judy, I think you're next with tuition reimbursement.
Yeah. So this doesn't affect the self-determination program, but it just annoys me. So I just wanted to raise it. There's $30 million in the budget to help service coordinators get tuition paid to get advanced degrees in health and human services field. And the only reason I bring this up is because no person in the self-determination program or no person who even is in the traditional system can get tuition paid for. It is actually forbidden by the feds, by the federal government, and forbidden by the state as well. It's very frustrating to me, honestly, that that this funding, you should know that social rec only is budgeted at like $21 million a year, and this is more than that. So it's very frustrating to me. I don't think I'm going to get on my high horse and start arguing against it and opposing it, but if somebody really wanted to mention it in any of your advocacy, this is like an example of what else could we do with $30 million to actually, help people of color who are facing significant racial and ethnic disparities. If we took that money plus the $11 million of that's going towards reducing racial and ethnic disparities, and just took that $41 million and gave it to everybody who's underserved to buy services, I promise you that would do a lot more. But go ahead, Connie.
I just want to thank you for raising this issue, because it's so frustrating to me. So again, as the pioneer, over time, there was always this debate, POS, purchase of services, versus operation costs and overhead. And now it's gone. It's just gone. It's so skewed against the services and direct services that people with disabilities need. And it just makes me sad. And I just want to thank you for raising it, because it's skewed. And somehow I don't think we're going to win this, but I think we need to point it out. Thank you.
Thanks, Connie. So Sandy Rowley in the chat is saying they should use that money to pay service coordinators more to stay in their position. I 100% agree with you, but I also wanted you to know that the Association of Regional Center Agencies, ARCA, has a proposal that it's not in the governor's budget, but they're hoping it will be in the legislators' negotiations to basically get more funding for service coordinators. It's called reducing their ratio. Okay, so right now, service coordinators have very high ratios. They have, some of them have 90, 95 clients. And that's because the regional centers don't have enough funding to hire more service coordinators. So each service coordinator has a lot of clients. Well, they want more funding to hire more service coordinators and pay them more. And so that funding may actually be there on top of this tuition reimbursement. So if that is the case, we're talking about increasing the operations budgets even more substantially. And so, that's part of my theme of 2022-23, which is no more excuses. You get tuition paid for, you're getting all these other benefits. Like many of us don't even have health insurance. So, all right, let's move along. All right, rate acceleration. So there was nothing in the governor's budget about rate acceleration, but so I'm going to tell you what is happening with that, because I know a number of people have been hearing about this issue. Last year, the budget that was heavily negotiated between the governor and the legislature had in it a 5-year process to increase the rates for service providers. The first rate increase happened on April 1st. By the way, all these rate increases are supposed to be tied eventually to better outcomes for people served by regional centers, and we are still waiting to see what those outcomes will actually be and whether they are meaningful in any kind of way. But the first increase in rates took place on April 1st, last month. That was 25% of the increase that particular service is going to get. It was not a 25% rate increase. Some people have been saying this wrong. No, none of these services got a 25% rate increase. But let's say that I could be wrong about the specific, but I believe that supported living got somewhere around a 40% rate increase. So a quarter of that went into effect on April 1st. So they got a 10% rate increase on April 1st. The next increase is supposed to take place next year on July 1st. What the service providers have been advocating for is to speed up that process and have the second installment, I guess you would say, of the rate increase to happen sooner, a year earlier, this July 1st. DVU, by the way, is supporting that rate increase. It was a hard-fought negotiation with many of the service providers because we believe that there should be some sort of proof that the rates are actually going directly to those direct frontline workers, those direct support professionals, and they have agreed to it. Hold on, I have to close my thing because the sun is in my eyes. Much better. And then, and for it to go to service providers who are providing inclusive services. So we are strongly supporting rate acceleration. And we don't know whether this is going to happen. There are negotiations between the governor's office and the legislature. The legislature is very much in favor of the rate increases, but so far the administration has been silent on it. And I am pretty confident it's going to happen. I think there's that the community is very unified around this particular issue, especially with this negotiated language that DVU is part of, where we are ensuring that the funding is actually going to direct support professionals. So, Lourdes, did you have a question about this?
So my question is, I'm coming across asking regional centers to reflect that increased rate for my clients into self-determination, and they're telling me that does not apply to self-determination clients, that rate is not there. So
that
for next year, if I have less money that the agency is using, I can't get somebody into self-determination when they're losing a full month of day program. It's just unrealistic and it breaks my heart. I can't do that to people.
Thank you, Lourdes. And I apologize, Lorna and Helen, for talking over Lourdes. That's a big no-no in our world. But I'm Jewish and I cannot help it. It is part of our faith. Lourdes is correct. In fact, I was at a public meeting that Nancy Bargman very specifically said, we haven't made a decision about whether the self-determination program would be part of the rate increases. which is of course ridiculous because anybody who's new to getting into the self-determination program, their budget is based on their current expenses, and the current expenses are based on the new rates. So not only are you treating self-determination program participants different than the traditional system, but you're also treating people who are currently in the program differently than you're treating people who are new to the self-determination program. So, and what is DDS saying? That our rates are frozen in time and that the rates could go up 10 years from now and we're still using the rates from 2018 or 2000. I mean, actually the rates haven't been increased since, what are the oldest rates? From like 2010, 2009, that those are the rates that we have signed on the dotted line forever. I believe we're going to win this. I really do. It's going to take a lot of us advocating, and we're going to have to go above DDS on this, guys. We're going to need to go likely to the Secretary of Health and Human Services, Galley, and to the governor's office on this, because or even I'm telling DRC, is this a lawsuit? Is this a lawsuit? Because you cannot treat us differently. You cannot. So anyway, thank you for bringing that up. Connie Boyer.
Can you hear me?
Yes.
Hi. I just wanted to mention, I've been talking to chief of staffs of several legislators because in the May revise, they didn't put in anything in about the rate acceleration, which to me showed, hey, nothing's going to happen here. And for example, where I live, what, 10% increase, that equates to about $1.70 extra. So that means now that my staff in SLS might go from 17 to 1870. Big deal. It's still not competitive. We still can't find people. So I just want to ask them, well, what do we do now since we seem to be totally ignored on this subject? They suggested writing to the budget committee members because they're going to be the ones that are going to negotiate. The governor is probably stuck in where he wants, he's not into the acceleration, but we might be able to make some inroads. And so I suggest everyone write to the budget committee. You can just Google budget committee, Senate, and budget committee assembly. And maybe hopefully one of you are a constituent of one of those people. That helps too. But we just need to really push right now in the next few days because they're going to decide this very soon. So that's my plea.
So Connie, I actually think that the focus needs to be on the governor and not on the legislature, because the legislature, I think, is behind this. Particularly Assemblymember Arambula is very, very behind this. So if I were writing letters, I would be writing to the governor.
I do both. Both. I forgot to say, yeah, absolutely. But yeah. I'm not sure where the governor is on this. So I think we need to write to both and everybody write into just a quick letter, please accelerate. We can't wait any longer. We can't wait another year. We can't find them now. It's causing people to suffer. They can't get workers. Yeah. So anyway,
Thank you, Connie. Appreciate that. Connie Lapin.
Well, it's Harvey.
Yeah.
Harvey.
First of all, it is discriminatory. Second of all, this has happened before in the state of North Carolina, did a rate increase and they excluded self-determination. And there was a massive letter writing campaign to the governor first and the legislature saying it was discriminatory. And that's where it's got to go. We have to stand up and be counted, because mainly these type of increases should be going to wages for community care workers, because let's face it, look what's happening with inflation in the community and the people that drive around. I've never thought I'd ever see over $6 a gallon of gasoline, meaning these are the people that get hurt. And these are the people that need the raises.
I just want to clarify something I said between purchase of services and operations. I wasn't talking about programs. I was talking about regional center. It was how much money was going into the bureaucracy or at regional center or DDS versus how much money was going into purchase of services. I just wanted to clarify it.
Thanks, Connie. So will Sanford put a link in if people want to support the rate increases, or These rate increases are going to happen anyway, guys. It's just, we're talking about making it faster because there's all this money in the state budget now. So we want to make the rate increases happen at a faster rate. So that the rate increases will definitely happen. What we'll put in does not get to the point of ensuring that people in the self-determination program get those rate increases. So that is something that we have to really work on. That is not a decision that is going to be part of the budget process. The pressure for that needs to be put on DDS. And you can use your legislative staff to put pressure on DDS for sure. Tim, go ahead, Tim.
Here is the issue. For the individual who uses vendor services, they are being charged more because these vendors are charging self-determination participants more at the new rate because of the rate increase, and many participants are running out of funds in their budgets.
That is probably the best argument.
Great
for
point.
us.
Great point.
Great point.
Yes, it basically means that someone in the self-determination program cannot use a traditional service provider. You have to hire people on your own individually, which is really not fair. I hadn't thought about that, Tim. That's actually our greatest argument. Tim, I'm going to put you out in front, as I do all the time. He's sick of me doing that. Okay, let's move it along. Go ahead. This is yours, Nina.
Okay, this is our, I think our last piece of this the slideshow, and this is this turned up in DDS's proposed trailer bill language, and this seems like a very good thing. So under existing law, you know, there's something called tailored day services, but there's some limitations on you know, the scope of those services, and under existing law they can only be offered in lieu of the traditional vendor day program or supported employment or work activity program, and the rates for those tailored day services are restricted to 80% of, you know, what the vendor's rate would be for the traditional service it is replacing. So so they tend to be, you know, not that many hours per week authorized, and you have to sort of make a choice, and, you know, a whole day could easily not get covered. Could you, I think we have one more, Judy, in part of this one. And so DDS's proposed trailer bill would change the existing law to get rid of those limitations and allow tailored day services to happen in conjunction with, not just as a replacement or in lieu of, a traditional day or employment program, and that 80% cap would be taken away, and, you know, you're just limited to the daily or hourly rate of the traditional service. So it seems like taking away those restrictions could make tailored day services more accessible to people who want or need programming for a full day, but want more customization than the traditional, you know, programs and vendor services. And it might create incentives for more vendors to offer up, you know, tailored day services for folks. So again, if this is something, if that's a kind of setup that you think you know, would be entitled to, interested in and entitled to, again, it's not only a good thing in and of itself, but could help, you know, in building your budget. And I think that's it for us in the slide.
So just a reminder that much of what we talked about today, all of what we talked about today, is not yet law. Okay, so don't go calling your regional center and saying, I want to take out my line item for my FMS, or I want to get coordinated family supports. A lot of this stuff has not gone into effect yet. And at the snail's pace that DDS works, it might even be a year before you have access to it. But we got to get it over the finish line and get it into law for sure. Sandra, go ahead, Sandra.
Well, I was just going to piggyback on the fact that the vendors have increased the rates. I've had to redo spending plans for several of my clients, and most of them are going to run out of money about 2 months before the end of their self-determination program will end. And one is critical supported living services. Can't live without it.
Yep. I get it. I get it. All right. Thank you, Tim Jin. You should come work for DVU. Oh yeah, you do. Okay, so we're going to turn down to questions from everyone. Will Sanford has his hand up. So just real quick, if you have a question, you can go down to reactions and press the raise hand feature like I just did. You can also ask your question in the chat, and Ed is going to go through the chat in a moment. So go ahead, Will.
Two things. One, I have had a couple of regional centers who are just taking the rate adjustments and passing them through without any question. They're not even asking that question. So, which is the positive that people understand, like, doesn't make sense from a fairness standpoint.
Yeah.
Just on the last TDS comment was, there is a little concern with the language as DDS drafted it, and that it could potentially eliminate TDS as a service for people who have been using it very successfully. Because of the way they drafted it, we proposed some changes with some other folks that hopefully DDS will go with. And then again, I think it would be really a bonus positive thing for people to have it both traditionally and in self-determination to really expand what budgets will be based on. I mean, I think it's a good thing in the long run if we can get them to fix that piece.
Thanks, Will. Jordan, go ahead.
Right now, yes, thank you. This is Jordan Feinstock. And I want to make the comment, we talked about FMSs a lot and how they're going to be paid through, not going to pay through the budget. I think, and I've said this before and I'll say it again, I know why we have financial management service, why they were put in place, but I believe they are the albatross around our neck that's going to destroy self-determination, because I've heard from people with different FMS agencies are having multiple problems accessing their budget. They can't get to the money they need. There is zero, I say it again, zero training for consumers on how to actually use their FMS, like how, to use it. Like if you want to get music lessons, zero explain how to do that, how to vendor somebody. And talking about vendors, nobody wants to be, half the people I talk to and other folks say they're people they want to use don't want to be vendored. But then you got that problem. The biggest issue is there's zero oversight for the FMSs, zero oversight. And some of there's a few good ones out there are booked till next year or later on, because they're not taking new clients. They got enough. That's it. So you're stuck with whoever's left over. And again, they are the albatross and lousy. And a lot of people are having a heck of a time in getting the money out of their budget. They just can't access their money. A lot of people don't want to be vendored. And so you have that issue. And I know why they need to be vendored. There's just people that don't want to be vendored, and there's some FMS to say, look, if they're not going to be vendor, then you can't use them. What am I supposed to do? Well, then you don't get that service. And they're slow to react, slow to respond. They do very little. So when people say they should get more money, I say, for what? Half the time, more than half the time, they don't do anything. And we need to find another way, if there is another way, to get rid of FMSs, get the money, because self-determination is about the be able to access your own budget instead of having to go through all these channels that are just not working. People aren't being used. And then on top of that, lastly, is that when you are vendored, somehow a lot of these vendors are not getting paid on. The vendors are not getting paid. The FMSs are not paying them for multiple reasons, and then they come back to the client. I've heard from people say, oh, the person I vendored didn't get paid, and they came back to my son, and I said, why weren't we paid? And then they had to go back to the FMSs, and then the vendor said, I don't want to work with you anymore because we're not getting paid in a timely manner. So I can't continue not to be paid, in a month and I haven't been paid. So maybe somebody has the answer to that, but I sure don't like them.
Jordan, we've heard that from a lot of people. We've talked about it many times in this STP Connect, that people are having very frustrating experiences with some of the FMSs. It's something that we are continually advocating with DDS on. We've actually had some of the FMSs speak with DDS about what some of their barriers are themselves. I can tell you what I've heard from some FMSs, and if there are any on this call, you can raise your hand. Some of what I've heard is that they receive the spending plan and the IPP from the regional center, and those are the funds that they expect to be paying for. They put out, remember, they put out the money and then get reimbursed from the regional center. They don't get the money in advance and then pay it. And so they put out the money for services that are written in a person's spending plan, and then they don't get paid for it. And in some cases, some of these FMSs are owed tens of thousands of dollars, sometimes even hundreds of thousands of dollars. And so they're starting to act very concerned about putting out money that they're not sure they're going to get paid back for. And so some people are like, they're saying to their FMS, you're acting like a regional center by not doing this. You know, I'm trying to be sympathetic because we need the FMSs to succeed. If they do not succeed, the self-determination program will not succeed, just like we need the independent facilitators to succeed. So I'm really trying to work with the FMSs and not to criticize them a lot, but to try to figure out where their barriers are and to try to give them the ability to do the best possible job for us. So that's just my little soapbox. Ed, now it's up to you. I know there's been a lot of stuff going on in the chat.
Oh, plenty of activity in the chat. So we're going to bump back to a question from Sonny all the way at the beginning of the SDP Connect, asking, this is great, referring to, I believe, to the monies that may be now put aside for FMS fees, but I don't understand the amount. Given the low number of people in the self-determination program, how does it even come close to this amount of money?
Yeah, it does seem a lot, and that there's some feeling that there's going to be lots more people in the self-determination program. Because if you go 7.5 million, hold on, I'm putting it on my little calculator. Is that, yes, that is 7.5 million divided by, let's say, $1,800 on average of fees. That's assuming there's going to be close to 4,200 people in the self-determination program. And right now there's just above 1,300. So it seems to be over budgeted, but let's just hope that really 4,600 people will enter the self-determination program in the next year. But you're right. It seems to be a whole lot.
Next question from Amin. I'm sorry, this is referring to the FMS slide that we had.
Right.
What about other FMS models?
Yeah, so all the FMS models will get the funding put in. So for it's $165 a month for the co-employer model, about $150 a month for the sole employer model, and less depending on how, for the bill payer model. So it will be the same regardless of which model you use. You will not have to put a line item in your spending plan to pay for the FMS.
Thank you for that, Judy. Next question from Connie. Who will be doing the training of judges besides DDS? And how can we be assured that appropriate training will be provided often enough?
Who asked that? Because that is an awesome question.
Connie Boyer.
Thank you, Connie Boyer. So right now in current law, DDS does the training for the judges, and they're supposed to consult with Disability Rights California in that training. I can tell you they don't really consult with Disability Rights California, and maybe actually the state council too. I can't remember. They don't really consult with the others, and they don't actually put on the trainings. It's been many years since they've done a comprehensive training for the judges. In that fact does not change in the budget proposal from DDS. If our bill gets passed, SB 1092, it will be required. Several things will be required with training. Number one, that the training is conducted in cooperation with self-advocates and family members, that they actually participate in conducting the training, number one. And number two, that the judges will be required to have training on the systemic racial and ethnic disparities that exist in our system, so that they understand that when a Latino comes who gets half the amount of services as whites and asks for an additional 4 or 5 hours of respite in that month, that the judges understand that this is a person from a race or ethnic group that has been historically underserved in our system. So that is not in the current budget, but it is in our law and in our bill. Sorry, our bill is not yet a law and has a long way to go. I should tell everybody that it is going to pass out off the Senate floor this week unanimously, and we're very excited. But then it goes to the Assembly floor. The Assembly committees. It'll be in the Assembly Human Services and the Assembly Judiciary committees over the next month. It has to be passed out of those committees by June 30th.
Thank you, Judy. Our next question is a question in Spanish from Griselda. I'm going to let Lorna interpret it.
Yeah, I agree with you. You should know that DVU was part of the group of organizations that supported the SDP ombudsperson, but we supported it to be a bit different than it's actually played out. We wanted to ensure that they were completely independent of DDS, and that they ran their own office and not be accountable to the director of DDS, which is what ultimately got passed. But we still have high hopes that Susie will come in and get some stuff done and really educate our community, regional centers, and others about what the true way we should be implementing self-determination and reduce some of those barriers. I'm wondering if Marie Vargas she has her hand up, and if you had a question related to that. You can go ahead and unmute. Go ahead.
I'm wondering if is you guys gonna make any classes or something to guide us how to start using the self-determination program, because I think it's a lot of information, and for many of us it's something new that we start getting used to it, like how to start with the services, how to ask the FMS or the person in charge of the budget how to start spending the money and the things the client from regional center is going to start need it and use it. And my second question is, in case does some of the services increase the prices, we going to keep the same budget, or is you guys have any way to ask or regional center help us to increase it or to adjust the budget we have it?
So for the first question of training, that's what this SDP Connect has been all about. We've probably at this point done close to 50 of these meetings, and some of them are really basic, like introduction to self-determination. And in the chat, Ed has placed our interchange, which has lots of information about self-determination, as well as you can look at the recordings of the past 50 SDP Connects and find topics that you'd like to learn more about. Okay. Also, Tommy Barmash is making an important point. every regional center has a local advisory committee. Many of the people I'm looking at on my screen serve on their local advisory committees. And you should really go to your advisory committee meetings. The dates are posted on your regional center website, and you should be asking for help from your committees. In addition, the committees have money to spend to help people in the self-determination program. And so they almost every regional center, probably all of them, provide funding for what they're calling coaches to help you in the self-determination program, answer your questions, guide you, maybe help you identify an FMS or an independent facilitator. And so that's another way to get a lot of your questions answered. I would normally say you should be asking your service coordinators for help, but a lot of them have not yet been trained on the self-determination program.
I'm afraid not. I'm afraid not. They're not full training, and that is something new for them too.
Yes.
And so your suggestion is to speak with my social coordinator and the coach to guide me better in the program.
Judy, do you want to say anything about local advisory committees meeting? Because some are meeting and some aren't because of Bagley Keene.
Yeah.
I'm gonna start assisting to those meetings already.
Great.
So I just knew as like many other people in the same system, and probably they have the same concerns, and not everybody are allowed to or have the chance to ask those questions to you guys.
Thank you, Marie.
Thank you.
We have to end in 1 minute because we lose our interpreters, but I want to just let everybody know, maybe we can talk about it at the next one, because I only have a minute to explain that many of the local advisory committees have been having a hard time meeting because they're under these requirements called Bagley Keene, which is a law that says that meetings need to be open to the public and be held in person. During the pandemic, we were allowed to meet by Zoom. I believe it actually increased participation in these local advisory committee meetings. But I don't know if you know this, but the pandemic has apparently ended, even though I know tons of people who currently have COVID. And these meetings are now back to meeting in person, and many regional centers are very uncomfortable with having these meetings happening in person. We promise we are working on a solution to that. It's not going to happen until July 1st. But I promise you, we are working on trying to advocate for a solution on that. So I want to thank birthday boy Harvey Lapin for coming today, and Connie Lapin, as well as Nina for presenting, and for Kira to create our wonderful presentation. We were asked to have this translated, and we will do that and get it to you and get it out there. But we will see you all in 2 weeks. We're going to have lots of, we will be getting information out to everybody about our next SDP Connect. And we want to thank you all for joining us today, and happy birthday, Harvey, and we'll see you all soon. Bye, everybody.